Good afternoon, class. My name is Rilla Mito, and today I will be talking about plan process improvement through electronic health records. To begin with, we will get the information to create an electronic health record to oversee a depressed patient. Based on the information given, the patient has been seen by an HMO staff private practice physician who then referred the patient to a private practice psychiatrist because the patient is dealing with depression for an unknown reason and the patient also has a pharmacy. The patient will be the one to receive all information and medication from the pharmacy. Once the patient gives the office a call, they will need to give their name, date of birth, information of their insurance, if they have, and a reason for their visit. On the patient's first visit to the primary care doctor, they will need to give their demographics, patient history, insurance history, their symptoms, and for it to be thoroughly described. During the visit, the patient will tell the doctor everything needed while the doctor evaluates this, leading to the doctor prescribing antidepressants and would like the patient to return in 3 weeks. The patient then goes and gets their medication from the pharmacy. After 3 weeks, the patient returns and feels the same. The doctor does some assessments, then refers him to a psychiatrist. The patient calls and makes an appointment on the same day. For the patient's first time at the psychiatrist, the patient is asked about demographics, their insurance verification, symptoms, their social security, and their medical history. Lastly, the patient is asked for the reason of their visit and their referral. During this visit, the psychiatrist refers the patient to do genetic testing and DNA testing to see why this is occurring. The genetic testing will be taken on the same day, but the DNA test must be ordered. The psychiatrist then prescribes the patient with one more medication for the night time and refers him to talk to a therapist. Second visit, the patient comes in and the DNA test arrives. The patient gives saliva, then the kit gets sent back for results. Patient is doing okay with medication, so the patient will continue with treatment. The patient will come back next week for the lab results. On the third visit, the patient comes in, and in this visit, the DNA labs are discussed. The patient is then told to continue medication and return every 4 weeks. Later, and the genetic lab results have came in, and so has the patient. To discuss the results, the electronic health record has been updated and results turn out to be genetic. The patient is put on better medication that is sent to the pharmacy and can be picked up later that day. Upcoming visits of every 4 weeks will involve a follow-up for the patient and if there are any changes, an update in the electronic health record. What you see here are roles of actors and actions. Here we have who viewed the patient's records. The psychiatrist and genetic lab were the ones who gave away the genetic information. Here is the information being passed along. Some were returned to have the electronic health records updated. To conclude, this method for this patient showed improvement in their depression, the treatment being medication and therapy. Since there's an improvement, the psychiatrist visits and medication would eventually reduce.